Welcome to Chemotherapy and You. This is a class geared to provide information for caregivers and patients undergoing chemotherapy. Today's objectives: to inform patients and caregivers about chemotherapy and common associated side effects, to provide information about initial interventions and treatments of common chemotherapy side effects that can be performed at home, to provide guidelines for when to contact the office for patients experiencing side effects from chemotherapy, and to provide resources for patients and caregivers who wish to learn more about cancer treatments and their side effects. For today's class, we will be focusing on general side effects that may occur with chemotherapy. Remember, you may have several side effects, some or none at all. This depends on the type and the amount of chemotherapy you receive and how your body reacts. Chemotherapy may affect your appetite or your desire to eat or drink. Factors causing poor appetite may be nausea, mouth or throat pain, fatigue, or depression. Some chemotherapies can also affect the way certain foods taste. However, it is important to eat well even when you have no appetite. Eating well helps your body fight infection and repair tissues that are damaged by chemotherapy. Not eating well can lead to weight loss, weakness, and fatigue. There are several ways to manage appetite changes, including eating 5 to 6 small light meals or snacks instead of 3 large heavy meals per day. You can also set a schedule for meal and or snack times to remind you when to eat, as you may not always feel hungry. Use plastic forks and or spoons to reduce the metallic taste in your mouth. Cooking in glass pots and pans may also help. Eat meals with family and friends when possible. Increase your appetite by doing something active. For example, you might have more of an appetite if you take a short walk before lunch. Limit fluid intake prior to meals to avoid early satiety or the feeling of being full. You may want to consider adjusting the foods that you eat according to your needs. For example, if you're having mouth pain, you may want to stick to soft, bland foods such as mashed potatoes or soft scrambled eggs. For nausea, bland, cool foods are better than warm foods as they have stronger smells. If you're experiencing diarrhea, stick to clear liquids or the brat diet, which includes bananas, rice, applesauce, or toast. Finally, those with fatigue may want to include meals that require minimal preparation time. Remember, you can lead a horse to water, but you can't make it drink. In other words, you can plan a perfect diet and hydration schedule, but once chemotherapy is on board, it doesn't always work out the way you planned. You may have aversions, including taste, smell, or texture, or any of the issues that we previously discussed. So, go with the flow. Eat what goes in and stays in. If you don't like water, add lemon. Drink Gatorade or other substitutes. Just make sure you get the fluids in. If initial interventions such as those outlined above do not work for you, talk to your doctor about other options for appetite changes. These may include a consultation with a dietitian, appetite stimulants such as Megace or Marinol, antidepressants, low-dose steroids, or nutritional supplements such as Boost or Ensure. Fatigue is one of the most common side effects of chemotherapy. It is often described as weakness, lack of energy, or feeling heavy or slow. It can range from mild to extreme feeling of being tired. It can be caused or worsened by several factors, including anemia, poor nutrition, dehydration, lack of exercise, shortness of breath, infection, overexerting yourself, lack of sleep, or even the medications that you are on. Chemotherapy-induced fatigue is not always relieved with rest. Fatigue can happen all at once or gradually over time. There are several ways to manage fatigue. Research shows that exercise can ease fatigue and help you sleep better at night. Try going for a 15-minute walk, doing yoga, or riding an exercise bike. It is important to plan to be active when you have the most energy. Plan short naps throughout the day. Many people say that it helps to rest for just 10 to 15 minutes rather than taking long naps. Get at least 8 hours of sleep at night. This may be more than you're accustomed to. However, it will be helpful throughout chemotherapy. Maintain adequate nutrition and hydration by eating 5 to 6 small meals a day rather than 3 large meals. Find ways to reduce stress and relax. Delegate tasks and let others help when you're feeling worn out. This includes allowing family and friends to help with household chores, or drive you to and from the doctor's office, or even do some grocery shopping and preparing meals that you can fix later. Consider an abbreviated work schedule if possible. And finally, don't overdo it. With fatigue, you may not have enough energy to do all the things you want to. Choose the activities you want to do and allow somebody else to help with the others. There are times when you need to talk to your doctor, and these include if your fatigue prevents you from doing everyday activities, if you decide to start an exercise program, or if you have interest in beginning nutritional supplements. Hair loss, also known as alopecia, is when some or all of your hair falls out as a result of damage to the cells that cause hair growth while undergoing chemotherapy. This can happen to hair anywhere on your body. Hair loss generally begins about 2 to 3 weeks after starting chemotherapy, and it takes about 1 week for hair to fall out completely. You may notice some scalp tenderness just before the hair begins to come out. Often, hair grows back in 2 to 3 months after chemotherapy is over. Your hair will be very fine when it starts growing back, and it may have a different color or texture than before. There are several ways to manage hair loss. Before hair loss, ask your doctor if your treatment will cause hair loss. Buy a wig while you still have hair. Many insurance companies will cover the cost of a wig with a prescription from your doctor. Cut your hair short or shave your head. This often makes hair loss easier to manage. Use mild shampoos and be gentle when washing your hair. Remember, do not use items that can cause harm to your scalp, including curling irons, hair dryers, dyes, or perms. After hair loss, protect your scalp by wearing sunscreen and/or a hat. Stay warm by wearing a turban, scarf, or hat. And try a satin pillowcase, as this causes less friction against a sensitive scalp. Some types of chemotherapy can cause damage to the fast-growing cells in your skin and nails. While these changes may be distressing or painful, most are temporary and do not require treatment other than good hygiene. Minor skin changes include rash, itching, dryness, and peeling, dark and/or hardened veins, sensitivity to the sun causing you to burn very quickly, as well as darkened, yellow, or brittle nails, or nails that loosen and often fall off. Major skin changes, however, should be treated right away to avoid long-term damage. These include radiation recall, where your skin turns red and often blisters, peels, or becomes very painful, chemotherapy that leaks under the skin from your IV, allergic reactions to chemotherapy, including sudden and severe itching, rashes, or hives, as well as hand-foot syndrome. There are several ways to manage skin and nail changes. If you're experiencing itching, dryness, redness, or peeling, consider taking quick showers instead of long hot showers or baths. Use a mild moisturizing soap such as Dove. Apply creams or lotions while your skin is still damp after washing. These may include Udder Cream, Bag Balm, or Aquaphor. Avoid products containing alcohol, including perfume, cologne, or aftershave lotion. And try oatmeal baths when your entire body itches. If you experience an acne-like rash, do not use over-the-counter acne products as they are too drying. Instead, keep your face clean and dry and ask your doctor about medicated creams or gels. If you experience sensitivity to the sun, avoid direct sunlight. Remember, the sun is strongest between 10 a.m. and 4 p.m. Always use sunscreen lotion with an SPF of 15 or higher. Wear a hat with a wide brim, light-colored clothing, or long sleeves, and do not use tanning beds. If you experience nail problems, remember to wear gloves when washing dishes, cleaning, or working in the garden. Use products to make your nails stronger, but avoid them if irritation occurs. And do your best to keep your cuticles well moisturized. If you experience radiation recall, protect areas of the skin that receive radiation from the sun, and do not use tanning beds. Notify your nurse immediately if you experience pain or redness at your IV site, or if you have a sudden or severe itching, rash, hives, wheezing, or shortness of breath during your chemotherapy infusion. Call your doctor if you develop a new rash, particularly if it is painful. Let your doctor or nurse know if your cuticles become red, swollen, or painful, or if you notice drainage from around or under your nails. Finally, call your doctor if you have blisters, redness, swelling, or cracked skin to the fingertips or palms of your hands, or the toes or soles of your feet, as these are signs of hand-foot syndrome. Certain types of chemotherapy can damage cells in your kidney or bladder, causing urinary changes. Therefore, it's important to drink plenty of fluids starting the day before chemotherapy and several days thereafter. Some chemotherapy drugs may even change the color of your urine. Your doctor or nurse will let you know if you are receiving one of these regimens so that you will know what to expect. In order to manage these urinary changes, your doctor will monitor blood tests regularly that will indicate how well your kidneys are functioning. It is important for you to drink plenty of non-carbonated, caffeine-free fluids, with water being the best choice. Remember, urinate regularly and don't hold it in. This may help prevent a urinary tract infection. Contact your physician's office if you have any of the following urinary problems: burning or pain with urination, frequent or urgent need to urinate, not being able to urinate at all, incontinence, which is the inability to control urination, blood in the urine, also known as hematuria, foul-smelling or cloudy urine, fever and/or chills associated with urinary symptoms, and finally, urine that's an unusual color. In conclusion, review the drug-specific printed materials provided to you by your physician carefully. Ask questions, and remember, there is no such thing as a stupid question. Be aware that every patient is different. You may experience none of the side effects, some of the side effects, or several of the side effects listed. Keep a notebook or journal of any side effects that you do experience and when they occur. For example, does fatigue occur 2 days after chemotherapy or nearly 1 week later? Bring this journal to your visits. This may help your doctor to know how to treat your symptoms. Take advantage of offered support groups, patient programs, and educational offerings. And remember, the physicians and staff here at CCI are here to support you through your cancer treatment. Please do not hesitate to call or ask questions if you are uncertain about any side effects that you are experiencing. For more information, please see available online resources listed. And thank you for participating in Chemotherapy and You.